next agenda item, which is a governance and leadership of the WHO European region. So, to help further strengthen WHO Europe's accountability and transparency and support particularly governance, the regional committee is invited to take note of WHO Europe's first top-line accountability report, which presents an overview of how WHO Europe is resourced, structured, managed, and governed. The regional committee is also invited to consider the application of 8 new non-state actors not in official relations with WHO to be accredited to attend the sessions of the regional committee. In addition, it will review the status of 4 non-state actors accredited at Regional Committee 70, RC70. The Regional Committee will be invited to adopt a related draft decision for this sub-item. Delegations are advised to contribute through written statements. The Regional Committee will then be presented with the comprehensive governance review overseen by the SCRC subgroup on WHO Europe governance and will be invited to consider the recommendations of the review. The Regional Committee will be invited to adopt a related draft decision. For this item, the relevant documents are displayed on the screen and the discussions will be taken toward in 2 segments. The first segment will address the topic of the top-line accountability report relating to business operations and leadership and partnership, including engagement with non-state actors and associated decision. The second segment will address the comprehensive governance review and associated decision. So, before we moving forward with this agenda item, I would like to give the floor to our distinguished regional director, Dr. Hans Kluge, for his introductory remarks. Dear Hans, the floor is yours.
Thank you very much, dear Executive President. And let me first and foremost also add to the congratulations for the National Day of the Republic of Kazakhstan. Congratulations. After what I heard from my respected colleague from France, of course, I cannot be left behind. Sizderde Respublika Kunemen, Shun Jurektin Kutkutuktaimen, Ashikaspan, Tolagai Tabistar Tleimen, Kazakh, Yele Jasai Person. I sincerely congratulate you on the national holiday of the Republic of Kazakhstan. I wish a peace, a great success and a further prosperity to the Kazakh land. Dear Member States, accountability is vital for the success of any organization. And I'm delighted that this year, at the midpoint in the EPW, the European Programme of Work, we are presenting you for the first time with WHO Euro's top-line accountability report, the TAR, which is a snapshot of how Euro is managed, led and governed. The TAR also demonstrates our efforts and action towards the recommendations of the 30th Programme, Budget and Administration Committee of the Executive Board, the PBAC, and the report delivered to the Executive Board in February 2020, just moments after I was appointed Region Director. Actually, this was an excellent report, which I always keep as a kind of a Bible to go forward on governance and management. And at that time, you made a number of calls that we have acted upon. First, you called for financial sustainability and improved financial management and efficiency. Coming from a historical position of budget deficit, we have kept a zero deficit budget sheet for almost 3 biennia now, with fully financed staff and activity costs. This despite the budget doubled and procurement tripled since 2019, which, as you can imagine, has placed an enormous pressure on our workforce. Second, you called for a culture and working environment that brings out the best in our workforce, to create what I call a psychological, safe work environment. Because if you're 75 years old as an organization, sometimes one is surprised by the vertical hierarchy and the lack of such a psychological, safe work environment, like in many big bureaucracies. But as we are the fastest growing WHO major office in the world, we have to ensure that we keep attracting and retaining top talent, particularly for a normative organization. The quality depends on the people we attract. We have increased our staff by 43% in an effort to meet the increased demand, mainly attributed by an 87% increase in workforce at the country offices, which, as Dr. Tedros was telling yesterday in his speech, meant that for the first time we have a parity, 50% of the staff in Copenhagen and 50% outside. But maybe more important, we managed to maintain a healthy gender balance, with women representing 55% of all staff. In this, we're the number one among the all 6 regional offices. And we're the number one globally if we look at the diversity, with 83 nationalities represented among the staff. Diversity is not an empty word in WHO Euro. Third, you called for greater attention to the prevention of sexual exploitation, abuse, and harassment, something I have been taking very, very close to the heart. With zero tolerance to any forms of harassment, we have recruited a senior regional coordinator, strengthened human capital for PRCH, with 17 part-time focal points and 3 full-time PRCH technical officers in high-priority countries, and ensure that our staff are completing all mandatory training. But from my own experience, I have been working in 3 continents and in conflict situations in the world. Training is only a small part. It's about the mentality change. Because even if you train the people and victims don't feel safe to step forward, we will get nowhere. So we have to be further feverish on creating this psychological safe work environment, and what I always tell, increasing our emotional intelligence. There's a lot of IQ in WHO, but not always the EQ, and we work very hard on that one. Fourth, you called for putting countries and country outcomes at the center and introducing more agile management practices that increase quality and responsiveness. Having served for 5 years with Médecins Sans Frontières in some of the most difficult circumstances on earth, agility is very, very close to my heart. Sometimes at the same time in WHO I learned going slower is going faster, because the rules also protect us. We have shifted the balance of our workforce towards country offices, as I was mentioning, as well as increasing the percentage of program budget allocation to country offices, while enhancing our agility and efficiency through the establishment of the enabling hub in Istanbul. Again, dear Deputy Minister of Turkey, my good friend Dr. Tolga, teşekkür ederim, and to Your Excellency Dr. Fahrettin Koca. This has brought me many, many, many sleepless nights. But we are there. I went in July myself with David, Mr. David Allen, who again I want to comment. And I must say, I was amazed by the start-up spirit of the WHO enabling hub, and a big, again, commending the Turkish counterparts for doing the way of business in a very, very agile way. I think this is the most difficult, the mindset. Staff has to be reminded that we do have a lot of privileges as WHO staff. If I compare this with my sister, who is a teacher in a secondary school in Belgium, and how much tax she has to pay as well, and working in a multicultural environment, it should be the ultimate pride and honor to work for WHO. I myself, I rotated every 5 years with my family, to whom I'm very, very grateful. Be it from Siberia, where I used to work in the prisons on tuberculosis control, to Myanmar under the military dictator, to the Democratic People Republic in Pyongyang, during the civil war in Liberia and Somalia. If one works with the United Nations, you subscribe to mobility. There shouldn't be any understanding or right to sit in a particular place till the end of your pension. You work with the United Nations, and I have been giving the example. But we always do it with due considerations for personal situations, particularly family. Because I'm a family man myself, and we do it in a very correct way. But people have to be mobile. Because otherwise you don't gain experience. You just do year after year the same thing. Fifth, you called for strengthened internal controls and greater responsiveness to audits. In the spirit of Kaizen and a culture of continuous improvement, I am happy to report that the external audit of Euro in 2022 resulted in an unqualified report with no high-risk recommendations, while all recommendations from the 2021 internal audit of the regional office have been successfully implemented. At the same time, an automation project initiated in 2020 has streamlined now almost all administrative procedures and protected us from an unprecedented number of cyber attacks. Again, thank you, David, and to your team, to your wonderful team in the business operation divisions, who in particularly felt this enormous stress due to the emergencies that we faced since 2020. Finally, you called for a new approach to resource mobilization and bolstering partnerships, so that WHO is positioned to shape health decisions, including through sound governing body management. In the past 3 years, we have transformed our resource mobilization mechanism. We have implemented governing body reforms, including in relation to the structure and agendas of regular sessions of the Region Committee and the nominations and elections process to ensure greater transparency and predictability. And thank you so much, Jelena from Slovakia, for highlighting that the progress there every year. And of course, as I mentioned yesterday, there's always more we can do, and we shall do more. And thank you to all the non-state actors who joined us. I'm a great believer of the non-state actors, having worked with NGOs for many years. I strongly believe if we are serious about leaving no one behind, you just cannot do it without the civil society and the NGOs, who are also the ones who tell us the truth, what is really happening at the field. Because I feel it in my own position. People are usually very, very polite, which of course is very nice, but sometimes you get also further from the reality. And the non-state actors, our friends from civil society, will always tell what is the real situation. What are the people really suffering from? That's why I'm very grateful to all of those who have been critical friends on the journey to prepare this first accountability report. In particularly, I would like to express my appreciation to the chair and the members of the SRC subgroup on governance, you, dear Marat, dear Anna, dear colleagues, under whose auspices the TAR has been developed. WHO is a member state-driven organization, and this can never be forgotten. And I would like here to thank also the Global Health Ambassador of Switzerland, Ms. Nora Kroon-Romero, who organized, I will always remember, the first in-person retreat, informal retreat of the SCRC coming out of the COVID-19 in beautiful Bern, which actually then was taken as an example for the executive board informal retreat in Geneva under the leadership of Dr. Vesna Petric, at that time the chair of the executive board, and our friend Dr. Clemens Auer from Austria, who was the facilitator. So we really set the stage for the globe. I'm very proud of this. Supporting member states to exercise participatory governance is essential to strengthening and maintaining trust. And we are very open-minded. We always want, what I call my motto is, to move from good to great. I believe that we're good, but we're not great yet. So I look forward to your critical and friendly comments and inputs in the 2 sessions today on leadership and governance and budget matters, as part of our continued commitment to ensure a resilient, responsive WHO Europe for the future, always with an eye to global solidarity. Thank you.
Thank you very much, dear Dr. Hans, for setting the scene and clearly outlining this very important report. Indeed, it is very crucial. The governance is a crucial element of building and maintaining the trust. And of course, there is always room for improvement in order to switch from good to great. So, with your agreement, let us continue with the segment 1, and I would like to invite Mr. David Allen, the Director of the Division of Business Operation Diseases, who will present key elements of the top-line accountability reports relating to business operations. So, Mr. Allen, you have the floor.
Thank you, Mr. Chair. As outlined by Hans, the region has gone through massive shifts during the past 4 years, driven by the EPW direction of an enhanced impact at the country office level and the large and complex emergencies in the region. While the EPW committed the region to a gradual and planned shift of resources to the new direction, the large emergencies presented a situation of immediate and exponential change impacting all business areas. And I would like to provide some more details to the points that Hans raised on the changes and how we have managed. As Hans pointed out, the changes are evidenced by Euro being the fastest growing region in WHO, particularly to a large increase in staffing at the country office level. And I would point out that the largest increase was in the National Technical Officer category, with their numbers increasing from 92 to 175 during this period. We therefore see a considerable change to the Euro business model, historically mainly operational at the regional office level, with an even split now of staff posted in country office and staff posted in the regional office, with this trend continuing as we speak, and in fact, reversing with more staff in the country office and the regional office as of today. Growing at such speed requires Herculean efforts from staff across all country offices and technical units, as well as the enabling services in the regional office, given the investment in time and required for recruitments and management training of new staff, and particular appreciation here is due to the colleagues in emergency operations teams. Expenditure analysis provides further details on the shift in Euro's way of doing business. Most striking is the change in the share of staff costs from 46% in 2018-19 to 31% so far in 22-23, and we expect this to reduce further to 25% by the end of this biennium. Most of the change is brought about by a substantial increase in procurement activity following the emergencies, which has now brought a considerable level of experience to the region, greatly improving our implementation capacity. As Hans mentioned in his report yesterday, we had tripled in value of procurement year on year between 2019 and 23. And as you can see in this chart, we are well on the way of tripling the biannual total value of procurement as well since 2018-19, as we expect to easily surpass 300 million in procurement by the end of 23. We will also experience more than doubling of other implementation mechanisms, including through direct financial cooperation agreements and grants to civil society organizations. These accomplishments necessitated a steep learning curve and adaptation to new ways of working across the region, supported also by the 3 levels of the WHE structures, the emergency division structures. To facilitate the increased volume and shift in types of expenditures, dedicated efforts were made to provide new tools and more efficient ways of working. Striving for highest efficiency and effectiveness, Europe became a region with almost fully automated business processes, practically overnight in 2020. And we facilitated expanded office premises across the region, with more than half of our 31 country offices either moving to new premises or increasing and refurbishing new office space. Through all this, we managed to maintain strong oversight and compliance, as evidenced by the different forms of audits and assurance we have gone through. These included 4 levels of oversight. The first is the external auditors that conducted a comprehensive audit of our regional office and the Moldova country office in 22, raising 32 observations. As Hans mentioned, none of the observations were high risk. In fact, they were all low risk. And we are well on track to close the 4 observations that are still remaining. During the past 3 years, the WHO internal auditors have looked at our 3 most complex country offices, including Uzbekistan, Turkey, and Ukraine, all resulting in partially satisfactory with minor improvement required ratings, which is a very good result. In each report, the auditors noted good practices from the country offices in the area of program and administrative management, and provided constructive observations which have helped us improve our operations in those countries and regionally. It is worth pointing out that for Ukraine, this is the first time that an audit of a country office in the middle of a grade 3 emergency has received this rating, and it is a testament to the great work of all the colleagues in the country office and those supporting regionally and globally. The EC has launched 6 verification missions this biennium to review expenditures against 6 large grants. In all cases, there have been no adverse findings. Lastly, since 2021, we have started to carry out professional assurance activities using external audit companies to assess the accuracy of financial records for cash transfers to implementing partners for grants and direct financial cooperation agreements that fit certain risk criteria. As an example shown here, we have to date reviewed more than 70 projects worth 18 million euros across our operations in Turkey. The same assurance modality is now being used in Ukraine and neighboring countries with similar types of contracts, and we'll be monitoring these results carefully. I would like to bring to your attention that in RC document Euro RC73/19, in noting the report, the regional committee is agreeing to discontinue this dedicated yearly report on audit and compliance, as we propose to include details on this performance indicator alongside others in the new top line and accountability report from now forward. With the shift in business model, there's been a change in expectations from management and staff to move from information check and compliance type of functions to operational and enabling support to new teams being established or expanded. It was reiterated that status quo could not be maintained, was not meeting the demands within timelines, and not realistic in the context of the European program of work. Throughout its planning and establishment, the enabling hub in Istanbul will now be allowing the regional office to increase staffing of enabling services within a feasible and sustainable financial envelope for more substantive and strategic operational support. It has indeed been demanding on managers and staff to perform day-to-day work, plan expansion, recruit, train staff, and improve client services under the prevailing challenges. We have so far navigated with very limited numbers. The enabling teams are motivated by the regional director's support and confidence in the process, which is allowing us to grow to required levels to meet ongoing and future demands. The establishment of the enabling hub was complex and not without challenges, requiring an ongoing consultative staff management process since 21. A plan was established, followed, and adjusted in the spirit of continuous improvement and leaving no one behind. And we will continue as we continue to grow and finalize the structures. I would like to recognize the Staff Association for having walked with us and with the staff in ensuring that interventions were targeted and reaching colleagues at the right times when it was felt that more support was needed. The Ombudsperson acted as a guardian of the process, and his continuous advice was invaluable towards greater transparency. Through regular conversations with the Director General and Headquarters Management, the Regional Director ensured that WHO was progressing in the right direction with the Enabling Hub, and he also ensured to keep Member States informed of our progress through the SCRC and RC meetings. While we possess considerable expertise from professionals who have worked in multiple contexts and countries, we need to strengthen a culture within staffing to support change for the better. Thanks for Hans's particular interest, Kaizen, a Japanese concept, has now been popularized across Euro management and across the support services. This does come with the required investment in the physical, mental health of our staff, as well as navigating emotions in the workplace. The regional director, while traveling and meeting with many of you, delegates in home countries, sees innovation and agility. We are aiming at the excellence being showcased in member states is reflected in the way our business operations serve all WHO offices outside of Copenhagen. The increasing demands from offices from all over the region have brought opportunities to showcase the ability and agility of the whole WHO Europe workforce. This has created opportunities for great cooperation across teams and has furthered WHO's mission at an accelerated pace. At the same time, the increasing demands have placed many staff in challenging and pressuring situations, exacerbated at times by instances of abusive conduct in the workplace. We can never ignore that negative behaviors sometimes exhibit themselves, and we have to hold ourselves up to the highest standards of zero tolerance. WHO has mechanisms in place to handle harassment and other forms of abusive conduct, and WHO Europe is seeking to do better in preventing incidents and planning initiatives towards embedding respectful behavior in all workplaces. Sexual misconduct of any kind by anyone working for WHO, be it as a staff, consultant, or a partner, is unacceptable. Our risk and PERSEA teams are working closely with country offices to identify, assess, and mitigate risk at the field level. Again, an example where the new Istanbul Enabling Hub is streamlining compliance and capacity needs, embedding PERSEA into day-to-day practice across operations and enterprise risk. Since 2021, in our region, we have one lead staff and health well-being survey, following which data has informed interventions for specific teams. We have fostered a culture of psychological safety in the workplace, which will be supported in 2024 by the recently created community of respectful workplace advocates. We hold general and targeted discussion work groups and trainings based on prevailing concepts and methodologies related to emotional intelligence, psychological safety, mindfulness-based mental agility, and crucial conversations that would encourage our diverse staff members across the region to be better equipped in their interactions in the workplace. And we established and filled full-time regional positions of ombudsman, ombudsperson, staff counselor, PERSEA coordinator, and in addition to the global support available through headquarters and employee assistance programs. Our objective is to have leaders and staff in WHO fully equipped to take action and support their colleagues when faced with situations as ever-increasing changing priorities or toxic behaviors. The regional director currently is personally leading a number of interventions, including with members of the Executive Council and senior staff, with the support of internal specialists, concentrated on addressing the main driver of workplace stress, which have come out of the yearly psychological safety surveys. A comprehensive action plan is under preparation, and dedicated resources are being assigned to ensure sustained attention to this important issue for Euro staff. Thank you, Chair.
Thank you. Thank you very much, dear David, for this comprehensive report in terms of the operations. And now I can see how much your division is doing in terms of keeping the work of the regional office is fully operational and leading the staff through the changes. It's something which is easy to say, but it's very, very difficult to implement. So, and thank you very much for your report, and all the best for your division, and good luck. Now, I would like to give the floor to Dr. Gundo Wheeler, the director of the division of country support and the partnership, who will present the elements of the top-line accountability report relating to the leadership and partnership, including engagement with non-state actors and associated decisions. So, Dr. Wheeler, you have the floor.
Thank you, Chair. So please allow me to present briefly some highlights from the third section of the top-line accountability report, which is on leadership and partnerships. Now, underpinning this section is the strategy for collaboration between WHO Regional Office for Europe and member states, which you adopted at the Regional Committee last year. This strategy was co-created with member states and is our blueprint for enhancing WHO's relevance and impact for countries, which stands at the very heart of the European Programme of Work. The implementation of the strategy has been guided very closely by the SCRC subgroup on WHO's work in countries that met 7 times during the year, with additional involvement of many other member states. And I really want to thank all SCRC members for their great engagement. Already we saw progress across 8 of its 10 core indicators, and you may wish to consult the Year 1 report on implementing the strategy, which was provided as an information document RC73/inf/4. The Secretariat wants to be a strong partner for you and support your leadership for health in your country. So strengthening our organizational foundation is hence important to us, so that you can be sure that whenever you interact with us, you access the combined expertise of all levels of the organization and of our partnerships. Over the past year, we've integrated our internal leadership structures with the first ever senior leadership team retreat that brought together all directors, WRs, and senior technical staff for 3 days in Belgrade. We've expanded our presence and added 1 country office in the course of the year in Cyprus to a total of now 32. And for the first time, as has been said before, we have as many staff and country offices as in the regional office. The treatment accountability report, by the way, has a great overview map on its middle pages that illustrates our country presence and strategic relations. We've launched country support teams to provide necessary focused support to member states on specific public health matters, a modality that is particularly welcomed by countries without country offices. And we are enhancing country-level leadership, including through an innovative health diplomacy dialogue that brought together ministry representatives, WHO representatives, and global public health leaders in Brussels. We believe it is vital that we strive to understand each member state individually, and we tailor our collaboration to the context and needs specific to each country. You told us that a more active network of national counterparts would enable valuable dialogue with and between countries. And this network is now active with growing participation. We are developing new country collaboration strategies in 18 countries now, which articulate our tailored medium-term strategic collaboration in the respective country. For groups of countries in similar geopolitical context, we have developed roadmaps for health, now covering almost 40% of our member states. Indeed, as the regional director has shared earlier last month, the Central Asia roadmap was endorsed in a gathering of the 5 presidents from the Central Asian republics, emphasizing that collaborative and strategic approaches for health are more important than ever. Finally, we are taking a similar strategic approach to enhancing our partnerships with intergovernmental organizations and networks, some of them here listed on the slide. Now, in its second successful year, the Pan-European Leadership Academy has the primary objective of cultivating and amplifying transformational leadership for health in countries. This year, we can celebrate the successful launch of Tier 2 of what we call ELA, which was for mid-career professionals, building on last year's successful launch of Tier 1 for early career professionals. So the ELA, as we call it, already now included 16 current and future health leaders from 10 member states. And we very much look forward to an exciting next year, 24, with further cohorts of the two established tiers, 1 and 2, and the launch of a third cohort of Tier 3 for senior health leaders. Strengthening all of our partnerships is crucial for the success of the EPW and for countries. The number of WHO collaborating centers in the region has increased to 265 in 33 countries, and we are bringing them in closer to become real partners in country support. We've intensified efforts to engage young people, launching the Youth for Health network last month, which is already covering 15 countries, and we are providing means for young people to participate meaningfully across all of WHO Europe's work. And we are excited to have so many youth participants and organization representatives and delegates here participating in the regional committee this year. Finally, WHO Europe engages more with non-state actors. In document RC73/6, the regional committee is requested to review the applications of 8 non-state actors, as well as the triennial review reports for 3 non-state actors, and adopt draft decision RC73/conf/1, which is on the accreditation of regional non-state actors who are not yet in official relations with WHO, to attend meetings of the WHO Regional Committee for Europe. Thank you very much, and back over to you, Mr. Chair.
Thank you very much, Dr. Gunda, for this valuable information. Indeed, building a stronger foundation for country support is very important for all member states, and I think your division is doing a very good and productive work in terms of making it even stronger. So in this challenging time, the health diplomacy is a vital issue, and I think the current regional committee is a good example of strengthening and building this health diplomacy among the member states as well. And just a few years ago, I remember when Dr. Hans initiated the Leadership Academy for young professionals. And now, in the year of 2023, we already have 2 years of graduates from this academy, and we can see that most of them are already contributing during this long week in Astana, and of course they are all contributing and building a capacity in a local and a global level as well. So congratulations, and by now I would like to thank all of our speakers, and let's give them a big round of applause for their job. Yeah. And now I would like to open the floor for the discussion. So please raise your name tags for those who wish to contribute. So first, Spain, you have the floor, please.
Thank you. Dear colleagues, I have the honor to speak on behalf of the European Union and its 27 member states. First and foremost, we wish to commend the progress achieved thus far and the continued efforts toward enhancing management and accountability, transparency, participation, organizational learning, staff well-being, and financial sustainability within WHO European region. We are particularly pleased with the introduction of the top-line accountability report, which provides a structured overview of key accountability functions and reforms through the use of 20 key performance indicators. Regular presentations of the report to the governing bodies will help to increase member states' oversight and guidance on WHO Europe's management and reform. In the context of the top-line accountability report, we would like to highlight several key aspects. We note the positive trends in allocated budgets, available funds, and implementation rates. The improved implementation status of the program budget reflects progress made in the European region. While we echo the Secretariat's call for sustainable and predictable financing on WHO Europe's base budget, we remain concerned about the long-term sustainability of the funding model. Emphasizing the imperative of normative and technical cooperation to enhance healthcare accessibility and quality within the European region, we also recognize the importance of making progress in the programmatic finance, governance, and accountability deliverables, in line with the recommendations of the WGSF to be implemented via the WHO implementation plan. We also support the work of the AMSTG in this regard. Regarding the business operations, we applaud the developments witnessed in recent years. We anticipate enhanced operational efficiency, especially through the reasonable allocation of staff at the country office level and parity in staffing between the WHO regional office and country offices. While we appreciate these changes, we urge continued dedication to cultivating a healthy and respectful work environment and ensuring the effective integration of prevention and response to sexual exploitation, abuse, and harassment into the WHO Europe's region's leadership, governance, and culture. We welcome the strengthened country operations aligned with the strategy for collaboration between the Regional Office for Europe and its member states, and look forward to further updates on this initiative. Moreover, we appreciate engagement with member states and partners both within and beyond the region, along with efforts to bolster accountability, transparency, and member states' involvement. These actions are essential for addressing complex health challenges and ensuring that our collective efforts reflect the diverse needs and priorities of all stakeholders. In this regard, we welcome the modified agenda and format for the Regional Committee, which align with our collective goals for strengthening leadership and partnerships within the European region. In conclusion, the European Union commends the progress made and expresses our commitment to the WHO Europe's mission. A strengthened governance and leadership are key to addressing complex health challenges. Thank you.
Thank you very much, Spain, for your group statement. And before we go to the countries, before we give the floor to the countries, I would like to mention that the top-line accountability report has been distributed to all member states in a printed version. So please take a look and use it for your reference. And now I would like to give the floor to Germany, following by Czechia. So Germany, you have the floor.
Vielen Dank, Herr Vorsitzender. Liebe Kolleginnen und Kollegen, guten Morgen erstmal von meiner Seite. Deutschland schließt sich natürlich vollumfänglich dem von Spanien im Namen der Europäischen Union und ihren Mitgliedstaaten abgegebenen Erklärungen an. Zunächst gratulieren wir dem WHO Regionalbüro für Europa zu den bisher erzielten Fortschritten im Bereich der Governance-Strukturen und danken für die kontinuierlichen Bemühungen zur Stärkung der Rechenschaftspflichten. Diese sind eine zentrale Säule der Governance-Strukturen. Besonders erfreut sind wir über den neuen Rechenschaftsbericht. Dieser gibt einen strukturierten Überblick über wichtige Funktionen und Reformen. Die regelmäßige Berichterstattung auf diesem aus unserer Sicht guten Niveau wird die Zusammenarbeit zwischen dem Regionalbüro und den Mitgliedstaaten weiter fördern. In Bezug auf den Rechenschaftsbericht möchte ich gerne mehrere Elemente hervorheben. Angesichts der Herausforderungen in der Region begrüßen wir, dass das Regionalbüro für Europa in den letzten 3 Jahren erheblich gewachsen ist. Sehr gut ist, dass dabei ein ausgewogenes Geschlechterverhältnis gewahrt wurde und die Vielfalt innerhalb des Personals sichergestellt wurde. Wir begrüßen ausdrücklich, dass das Regionalbüro im Einklang mit der Strategie Gemeinsames Handeln für eine bessere Gesundheit seine länderspezifischen Aktivitäten erheblich gestärkt hat und hinsichtlich, wie schon mehrfach benannt, hinsichtlich des Personals, eine Parität zwischen dem Hauptbüro und den Länderbüros erreicht hat. Mit einer Gesamtzahl von 32 Länderbüros in der Region erwarten wir nun eine noch größere operative Effizienz, um die Wirkung auf Länderebene zu maximieren. Wir gratulieren zu diesen wichtigen Erfolgen, betonen aber auch die Notwendigkeit, sich weiterhin für ein gesundes und respektvolles Arbeitsumfeld einzusetzen. In diesem Zusammenhang loben wir die deutlich gestiegenen Abschlussquoten bei Schulungen zur Prävention von sexuellem Fehlverhalten. Wir bitten das Regionalbüro, an diesen Anstrengungen zur Verhütung und Bekämpfung von sexuellem Fehlverhalten festzuhalten und diese fortzusetzen. Wie bereits schon benannt von meinem spanischen Kollegen, die gestärkten Governanz- und Führungsstrukturen sind von zentraler Bedeutung für die Bewältigung komplexer gesundheitlicher Herausforderungen. Vielen Dank.
Thank you very much, Germany. Now we give the floor to Czechia, following by United Kingdom. So Czechia, you have the floor, please.
Chair, Regional Director, distinguished delegates, ladies and gentlemen. The Czech Republic aligns itself with the statement delivered by Spain on behalf of the European Union and its member states. In our national capacity, let us focus on the strategy for collaboration between the WHO Regional Office for Europe and member states in the WHO European region. We see the strategy as a historic opportunity to establish a continuous and active dialogue between the regional office and member states. We would like to thank the WHO Secretariat for the presentation summarizing the activities of the first year of the strategy implementation. We greatly appreciate the progress that has been made in such a short time. Regarding the WHO collaborating centers, there is a huge potential in the network that is being developed. We would like to encourage further work on this tool, and we hope that in the future it will also be possible to use the network as a guide for member states wishing to collaborate with the centers, provided they have sufficient capacities. Concerning the network of national counterparts, we would encourage more informal exchanges among counterparts, including in the meantime of their regular meetings in the margin of governing bodies. It would be beneficial to use modern communication platforms to informal discussions and experience or view sharing. The models of country collaboration need to be developed in an open dialogue between the regional office and the member states concerned. We look forward to the outcomes of the exploration of the value of a multi-country WR model. Last but not least, we would like to comment briefly also on the fourth building block, which deals with ways of working for country-level impact. We see the ongoing lessons learned process from the country support team exercises as very important for further improvements and delivering the support that countries really need. As regards the continuation of the Pan-European Leadership Academy, we would welcome more information on the establishment of a multi-donor trust fund to support the sustainability of the Academy, as mentioned in one of the budget documents, namely EUR/RC73/17. The Czech Republic is ready to cooperate on the implementation of the strategy and looks forward to playing an active role in the process. Thank you for attention.
Thank you very much, Czechia. Now I give the floor to the United Kingdom, following by Slovenia. United Kingdom, you have the floor.
Thank you, Chair. Can I just start by saying huge thank you to the Regional Director and all of your team for the work that you've done and that you outlined to us this morning. It's a huge agenda in some challenging times, and the work of the regional office has really changed as a result, and you've flexed and changed with it. So thank you for that, and particular thanks also to the Regional Director for the comments you made about, and to David actually, the comments you made about the importance of staff and the culture that you're trying to put in place, which are very important. Just second point, on procurement, really struck by the fact that procurement has become such an important part of the business of the office, and it was good to hear the increasing resource that's gone into that. Just to underline the point that you made yourselves, that you know, this is quite a change in the way the office is operating, and brings brings a different set of skills and a different set of risks. So it was really good to hear that the office is responding to that, and very encouraging to hear the positive audit outcomes. On the top line accountability report, I think this is a really important innovation. Really helpful to see. It's great to have the key performance indicators. Those reveal some quite interesting numbers as we go through, and as we build on those over time, I think it will be important to look at how those trends evolve. But overall, really encouraging to see that. And then finally, I think just two quick points. Firstly, to pick up on the point you made about modelling governance improvements for WHO more broadly. I think the region is doing that, and that's very great to see and encouraging to see. And then finally, just on the point that Germany also made on, and others have made on partnership, it does feel like over this period we're seeing a greater partnership between the Secretariat and Member States on how the region is operating, and that's something that we very warmly appreciate. Thank you.
Thank you very much, United Kingdom. Now we invite Slovenia, following by Norway. Slovenia, you have the floor.
Yes, thank you, Chair. Slovenia aligns itself with the statement made by Spain on behalf of the EU. We want to thank you, Regional Director, for your reports on this matter and for your tireless efforts to move, as you say, from good to great. With this statement, we will cover both discussion points. Let me first congratulate you and your team for the great work done in transferring the lessons learned from RC72 to the conduct of this meeting. The process of the member state-led resolutions, reducing the number of technical items and giving more prominence to the discussion on governance and other innovations just mentioned are examples of important improvements. Having the honor of serving on the WHO EB, we can see how some of these innovations could serve also on the global level. We believe that a two-way exchange of best practices contributes to all of us at all levels to perform better. Slovenia is in line with what has been mentioned by several countries earlier today. EB members from our region represent all of us. It would be thus important to consider the role of the EB members from the region in bringing forward globally our regional priorities. In this regard, it would be useful to further strengthen the links between the SCRC and the EB members and ensure that the EB members receive appropriate onboarding to perform their duties appropriately. Dr. Kluge, we also see the Euro region as a place to pilot innovation in the ways of working of our governing bodies. You mentioned the EB retreat last November, where the ways of working have been discussed. We intend to bring the developments and innovative approaches in our region to the attention of the EB again during its retreat later this year in Doha. Slovenia also commends you, Regional Director, for investing into developing leadership capacities within countries at different levels through the Pan-European Leadership Academy and the Public Health Leadership course. This will ensure that we have an ever-growing pool of capable individuals within member states who can also effectively work in the governing bodies of the organization. We look forward to further developments of these programs. Finally, we would like to thank you for giving us an opportunity to fit into the GPW14 process at the Regional Committee. We need to make sure that whatever member states adopt as the next general program of work resonates nationally, regionally, and globally. Offering us an opportunity to discuss it here will contribute to the coherence. Thank you.
Thank you very much, Slovenia. Now I give the floor to Norway, following by Switzerland. Norway, you have the floor.
Thank you, Chair. Norway acknowledged increased pressure on the WHO euro and the increase in need of activities, especially due to the crisis in Ukraine and the Middle East. We welcome the assurance of having the right competencies available at the right place at the right time, and we will thank the regional director for all the good work. We appreciate new measures to address the need for a change in the business model to enable Euro to operate in the new context of business operations, including strengthening integrity and accountability functions to ensure that WHO Euro can deliver on its goals and at the same time can handle risk, resources and staff. We note that the standalone accountability and risk management function will build staff capacities and increase knowledge of the role of risk management and compliance. We value the focus on this important area. More information on how you cooperate with the headquarters and other regions would be helpful. There has been a significant increase in procurement. This is an area with high risk of fraud and corruption, and the risk is even higher in the present context. We appreciate more information on how this risk has been mitigated in the process and how the risk is being managed in a proper way. We welcome the achievements of milestones concerning prevention and response to sexual exploitation, abuse and harassment, and encourage to keep up the faith. Finally, we thank the Secretariat for the first version of a top-line accountability report. The report gives a good overview of how WHO is resourced, structured, managed, and governed. Accountability and transparency is a prerequisite to create trust, and trust is needed to reach the goal of 50% assessed contribution in 2030. Thank you.
Thank you very much, Norway. Now, I give the floor to Switzerland, following by Monaco. Switzerland, you have the floor.
Merci, Monsieur le Président exécutif, Monsieur le Directeur régional, Mesdames et Messieurs, chers collègues. La Suisse saisit cette occasion pour remercier le secrétariat pour son travail sur l'examen complet de la gouvernance du Bureau régional de l'OMS pour l'Europe et pour son engagement auprès des États membres dans le cadre d'une approche participative. Nous saluons la revue de la gouvernance en vue de l'élection du directeur régional l'année prochaine. Nous considérons particulièrement importantes les recommandations formulées pour le renforcement du rôle et de l'objectif du CPCR. En effet, nous sommes fermement convaincus qu'une participation au CPCR prépare idéalement les États membres à leur rôle au sein du Conseil exécutif et leur représentation de la région dans ce cadre. En outre, la Suisse poursuit son engagement en faveur d'une OMS forte au centre de l'architecture mondiale de la santé. Par conséquent, il est essentiel de garantir et d'améliorer la transparence du processus de sélection pour les sièges au Conseil exécutif et au comité permanent du comité régional, afin de renforcer la confiance dans la gouvernance et les candidats. La Suisse réaffirme par la présente son soutien aux travaux en cours sur la réforme de la gouvernance de l'OMS et du Bureau régional de l'OMS pour l'Europe. Je vous remercie de votre attention.
Thank you very much, Switzerland. Now we give the floor to Monaco, following by Bulgaria. Monaco, you have the floor.
Je vous remercie, Monsieur le Président exécutif, et à mon tour de vous souhaiter une très belle fête nationale parmi nous. Monsieur le Directeur régional, je souhaite vous remercier pour le rapport qui a été présenté. Nous sommes tout à fait conscients, comme d'autres l'ont dit, des contraintes qui pèsent actuellement sur le bureau régional en raison des crises qui ébranlent notre région. Mais nous tenons particulièrement à vous féliciter pour avoir su adapter et le travail de vos équipes, leur permettant de répondre à ces urgences, tout en poursuivant le travail normatif qui est au cœur de votre mandat. En cela, nous souhaitons aussi féliciter l'ensemble des personnels de la région qui sont extrêmement dédiés à leurs tâches et nous comprenons tous les éléments qui ont été développés afin d'assurer justement la santé au travail pour les équipes de la région, y compris le harcèlement sexuel, et nous vous en félicitons. Si vous me permettez également, je souhaitais parler de l'enquête qui a été faite sur la gouvernance. Et là aussi, nous souhaitons vous féliciter d'avoir entamé cette enquête à large étude et l'étude qui a été menée par Michaela Told. Et nous pensons qu'il y a beaucoup d'éléments à prendre et à développer au sein de cette région et qui pourront servir, comme cela a été dit par d'autres, au niveau mondial pour renforcer l'efficacité du travail général de l'OMS. Donc, une fois encore, nous souhaitons vous féliciter et vous remercier pour le travail entrepris et peut-être encore plus particulièrement pour écouter les États membres, ce qui n'est pas toujours le cas. Je vous remercie.
Thank you very much, Monica. So, next, I would like to invite Bulgaria. Please, you have the floor.
Thank you, Honorable Chair. Bulgaria would like to thank the WHO leadership for the sustainable efforts to ensure transparency and accountability of all activities of the organization. We welcome also the equal distribution of human resources between the regional office in Copenhagen and the country offices, which is contributing significantly for the successful implementation of activities related to biannual cooperation agreement and additional activities in the area of provision of support for the Ukrainian refugees. In this regard, we would like to thank also for using Bulgaria as a country where the first assessment on the capacity of the country to host and to cover the health needs of migrants and refugees was performed, which is enabling the region for better tailoring to the needs of the people who are most in need and who are vulnerable. We would also like to thank for the external audits which are performed to the activities with external partners in Bulgaria, which is contributing to the transparency and accountability of all actions in the member state. Thank you.
Thank you very much, Bulgaria. As there are no more member states asking for the floor, okay, I see Uzbekistan raised the name tag. So please, you have the floor, Uzbekistan.
Thank you so much. On behalf of the Minister of Health of Uzbekistan, we would like to thank our regional director, Mr. Hans Kluger, for all his active work doing in our region, and especially was given high support to the Republic of Uzbekistan. And we can see, based on the results of audit report, that Uzbekistan country office has done a good job, and we are thankful to our country office staff, headed by the Dr. Ashina Halakdina as well. And taking this opportunity, we would like to congratulate the Minister of Health of Kazakhstan, Dr. Ajar Giniat, and her staff for this highly dedicated work to conduct these two big events. The conference, first of all, for primary health care, and we could bring here even 6 our head of directorates from Ministry of Health who are pointing out in a high level work in this primary healthcare conference. And also we are willing in the future to share their results in our country and bring more our colleagues to share their experiences succeeded at primary healthcare. Also, we would like to greet them on their Kazakhstan Independence Day. Thank you.
Thank you very much, Uzbekistan, for your warm words of congratulations. So I don't see any other name plates raised, so which means that, oh, okay, I see. Yeah, Turkmenistan. Turkmenistan, please, you have the floor.
Уважаемый президиум, уважаемые коллеги, дамы и господа, позвольте поблагодарить за предоставленное слово. Прежде всего, туркменская делегация выражает благодарность за прекрасную организацию и горячий прием наших коллег из Республики Казахстан и ЕРБ ВОЗ. Туркменистан считает здоровье одним из важнейших приоритетов, тесно связывая их с осуществлением повестки дня на период до 2030 года и целей в области устойчивого развития. Мы твердо привержены здоровью и всеобщему охвату здравоохранения, уделяем большое внимание ресурсам работы в основных областях. Стабильные механизмы финансирования, высокоэффективные услуги, качественные человеческие ресурсы для здравоохранения и другие. Пользуясь данной возможностью с поддержки регионального бюро ВОЗ, позвольте пригласить всех вас на международную конференцию высокого уровня по вопросам профилактики и борьбы с неинфекционными заболеваниями, посвященную десятилетней годовщине Ашхабадской декларации по НИЗ и планируемой 9-10 апреля 2024 года в столице Туркменистана, в городе Ашхабаде. А братский народ Казахстана поздравляем с национальным праздником, Днем Республики, и желаем благополучия и процветания. Благодарю за внимание.
Thank you very much, Turkmenistan, for the warm words of congratulations as well. And are there any member states who would like to take the floor at this moment? I don't see any other member states who is willing to contribute at this point. And now I would like to give the floor to our partners. So please raise your nameplate if you wish to speak. So I don't see any nameplates raised by. Yeah, I see, but it's a non-state actors, right? So first we should give the floor to our international partners. So there is no international partners who would like to take the floor at this moment, and now I need to give the floor to our non-state actors. So please, you have the floor. I don't see you directly, but.
Hello. Good afternoon.
We are pleased with the announcement today that the European Early Career Nurses and Nursing Students Association and 8 other newly accredited non-state actors are now able to participate in meetings of the WHO Regional Committee for Europe. This recognition is an honor for ENSA as it is the first student nursing organization to be recognized as an accredited non-state actor. It provides the opportunity to bring the voice of young nursing students and early career nurses in Europe closer to the WHO Regional Office for Europe. ENSA promotes a high standard of nursing education and research, healthcare services, working conditions, professionalism, and interprofessional collaboration. We connect early career nurses and nursing students across country borders and support them on their professional journey. ENSA recently joined the WHO Regional Office for Europe's Youth for Health Network, which again provides another mechanism to meaningfully bring the perspectives of young nursing students and early career nurses into the work of the regional office. ENSA would like to commend the regional office for the health and care workforce in Europe. Time to Act report and the Member States' endorsement of the framework for action on the health and care workforce in the WHO European region 2023-2030. Elevating and prioritizing the needs and dreams of health and care workers is important to ENSA. High rates of attrition will continue if working conditions remain poor and career progression. Value and support does not meet the expectation to deliver high-quality care to patients. ENSA are committed to supporting Member States and regional office in efforts to strengthen the healthcare workforce, ensuring the voice of students and early career nurses are included. Thank you.
Thank you very much to the European Nurse and Student Association for these remarks, and it will be noted by the Secretariat. So I don't see any other non-state actors who would like to contribute at this point. And then we will move to the Secretariat response, and I would like to invite Dr. Allen and Dr. Wheeler to respond for the points which was highlighted during the discussion. So, David, you have the floor.
Thank you so much, Chair. So I wanted to thank all the member states for the very positive and encouraging statements. It has indeed been a lot of work and by a lot of people across all the divisions. And so I thank you on behalf of everybody. We are continuing this work, and I can assure you we are on the path towards increased efficiency and performance as described. There were two specific questions, I think, from Norway. The first one on the standalone risk and accountability function that we're building. And indeed, this is, for me, it's a graduation from the compliance role that was started in the organization as a dedicated service some years ago. And now we're looking at accountability and performance and risk management instead of only compliance. Again, away from ticking the boxes towards more substance. And we're partnering, of course, with the CRE functions in headquarters, as well as the business intelligence and data analytic functions in the BOSS division in department in headquarters. So this is very much a work together, and we see Europe, the European region, really setting a new path forward in WHO on how to manage our risks and look at how well we're doing in compliance. Specifically in the environment that we're in of increased delegation to country offices, and we're embarking in that this year in the European region, and that comes to the second question on procurement, where of course I can tell you right now on the indicators, Europe is #1 across regional offices. I was just looking at the report from our Global Service Center in Kuala Lumpur, both for procurement and for payments. We have the lowest percentage in findings from them in terms of coming back for questions and documentation. So, and this is because we have a very strong centralized oversight. Now that's going to change a bit, and we're in the process right now of changing how we do the oversight at the central by delegating more authorities, but also competencies and capacities at the country office level. We're making procurement training mandatory, not just for the staff involved in procurement, but for all technical staff across the region. That's a number one. And we're ensuring that those staff who have actual approval or clearance delegations and functions are continuously watched over and given the required trainings. So we're looking at this carefully, especially in the context of procurement. But at the moment, we're quite confident with what's happened in the past 2 years. A lot of it is large-scale catalog procurement, but it's also a large-scale service procurement. And it's a service procurement where the higher risk is at the moment. And we're moving towards putting in enhanced post facto rather than pre facto in order to support the country offices in managing this locally. Thank you.
Thank you, David. Now, Dr. Wheeler.
Thank you. Thank you, Chair.
You have the floor.
And thanks to all of you member states for your comments and for your support to our role and our efforts to enhance leadership for health and partnerships for health through implementing the strategy. And that's a strategy that we take very, very serious in implementing it, as you will hopefully have noted also through the report that we've provided on year one. We've definitely noted the welcoming comments that you've made in terms of strengthening our presence in countries. As you've said, it is critical to have the right people at the right place, and that's really what we are striving for. But it is, of course, not only a question of numbers of country presence and staff, but also the ways of working. And this is why we've placed much emphasis in the first year of piloting some of the innovations that we have proposed together with you in the strategy in the first year. Now, as we are moving forward into the second year, we certainly want to expand the circle and take some of these pilots to scale. And I've noted also the calls, including from Spain and the EU and other member states, to enlarge the circle of member states who will brought into those innovative ways of working together and to scale up implementation of the strategy. And this will also then further develop some of the elements that we didn't have so much opportunity to elaborate in the first year, and that includes the multi-country WR model that you've referred to. It includes also further elaborating this modality of country support teams, and we've also noted the request to further look into ways how we can make the network of collaborating centers more directly accessible for member states. Now, there is, of course, a question of taking to scale. There's also a question of sustainability for some of those modalities, and thank you, Czechia, for pointing out that indeed we will need to discuss, and we'll be happy also to discuss with you how we can ensure sustainability, also financial sustainability of some of the modalities, including that of the European Leadership Academy. Also, as Czechia, you've pointed out, the strategy and the collaboration that we've established over the last few years on this is indeed a historic opportunity for an ongoing, open, and also informal dialogue. So we cannot agree more with you, and we are certainly keen to preserve the spirit of co-creation and collaboration also going forward. And I would just want to re-acknowledge the important role of the SCRC subgroup on our collaboration with country, providing such a fora, and excellent sharing by the chair, Dr. Alina Steflova, from Czechia. We certainly hope that we'll be able to carry forward that spirit and also that subgroup into the next year. And maybe just finally to briefly end up with also heartfelt congratulations to the European Nursing Student Association for being accredited. Well, its decision is not taken yet, but I hope you will agree, and for joining us as in the group of the non-state actors. And it's a double win for us because it's a non-state actor, which is important to us. It's also one representing specifically young people. I want to also thank the 33 non-state actors who actually came to Astana and who are with us. We had a wonderful meeting this morning, a very productive meeting, asking for their advice on how we can further strengthen collaboration. And I think this is one of the situations where our regional director's advice to go from good to great applies. We've done a lot to strengthen collaboration. We got a whole lot of suggestions to take it further, and we are committed to do so. In many ways, during, before, and after regional committee meetings, there was a suggestion to actually develop a strategy for collaboration with non-state actors, and that's something that we'll be happy looking into doing together with you over the next year. Thank you.
Thank you very much, Dr. Gunda. And now I would like to invite our distinguished regional director, Dr. Hans Kluge, to provide his responses. So over to you, Dr. Hans.
Thank you, Dr. Marat. And I would like to thank all the colleagues for your feedback into this session that we prepared very, very diligently, actually since Tel Aviv, because we know that several of you had quite a bit of concerns that due to a number of reasons, last year we did not get really to this agenda. So I'm very, very glad, really, very happy that you see that we took this on board, and as Ambassador Lanteri was mentioning, that we did listen, and we do always listen to the member states. I would like to thank here in particularly the colleagues who supported us in the development of the accountability report. You, Dr. Marat, first and foremost, Dr. Marat Sharanov, Anna and Nikki from the UK, Arne Petter from Norway, Uti from Finland, Björn Kummel from Germany, and you, Joseph, and Jelena from Slovakia. And we will now go a step further, incorporating the reflections that we heard today. Thank you also to our colleagues from Uzbekistan and Turkmenistan for the appreciation and the very valuable input. You know that Central Asia is a top priority sub-region for me. And I'm also very inspired, like you, Gondo, to listen to our colleagues from the European Nursing Student Association. You know that nursing and midwifery is very close to my heart. They always say that the best advocates for nursing are the sons from mothers who are nurses. So I'm one of them. So you can always count on our strong advocacy, not only advocacy, our strong support to that program. And I want to thank also here Maggie Langens, who is our dedicated officer in WHO on nursing, because it started with that one, that if you're serious, you have to have also walk the talk, your own chief nursing officer in the organization. My appreciation, echoing what you told, David, to the staff association, URSA. This is a very important relationship we have. And to all the staff of WHO Euro, the directors, my own directors, because a lot of pressure, of course, goes from me to them. And we try to walk the talk among our director group also on emotional intelligence, because staff is looking how the directors among themselves behave. Each 6 months, we are also holding our own executive council retreats. The next one will be 30 November and 1 December, because we are traveling so much that this is very precious time when all of us are being together. So we have this joint commitment every 6 months to go a little bit outside of Copenhagen, sometimes with external facilitator, to really reflect, because you know how it is. You face this for sure also yourself. You're so much drowned into the detail and firefighting and damage control that you need to be taken out of context and then think whether you are really right on track, not only the acute emergencies, but going towards the goal of the EPW, in which all of you put your trust 4 years ago. And finally, my appreciation goes to all of you, the member states, for your trust, because this is not an easy climate as a manager. Basically, every day you have to make risky decisions and to be brave, because that's the job. but ultimately there are very few protective mechanisms that I see for my managers, including myself. If you're investigated by the internal oversight, you don't even have the right to have a lawyer. So honestly, you're quite defenseless. I have no problem to be investigated, you know, be it by internal oversight or anyone else. My father taught me what matters is if you brush your teeth in the evening, you can look in the mirror and you have to ask yourself the question, did I try everything I could in line with your values of respecting the other person like you want to be respected and to do your utmost? And if you can say yes, it was another successful day. But in order to implement all your recommendations, I count continuously on the trust by the member states and to have our back. Thank you.
Thank you very much, Dr. Kluge, for your tireless effort and being always in touch and being with us in any case and situations. So we feel your support, and I think all the member states will agree with it. So to conclude this agenda item, yeah, sorry about that. To conclude this segment of the agenda item, we are now ready to consider the adoption of proposed draft decision contained in the document EUR RC73 conf./1 on engagement with non-state actors, accreditation of regional non-state actors, not in official relations with WHO to attend meetings of the WHO Regional Committee for Europe. And now I would like to ask if the committee willing to adopt the proposed draft decision by consensus. Well, I see no objections. Then I declare that the decision is therefore adopted. So now we move to the second segment of this agenda item. So let us continue. And I would like to invite Ms. Gabrielle Jacob, Regional Advisor Governance, who will present relevant information from the top-line accountability report on the governing bodies as the key outcomes and the recommendations of the comprehensive governance review. So, Ms. Jacob, the floor is yours.
Thanks so much, Chair. Good afternoon, everyone. And thank you to Slovenia, Switzerland, Monaco, and other colleagues for your comments and interventions on our work in governance in Euro. The EPW specifically commits to increasing engagement with member states and partners across and beyond our region. The commitment to strengthened accountability and transparency while supporting enhanced member state engagement has and is driving governing body management relevance and oversight in our region. As reported in the TAR, for example, there was a 31% increase in the number of governing body meetings and associated briefings and sessions in the last governance cycle. In addition, and as already noted by Member States' colleagues, in a bid to ensure more efficient and effective regional committee sessions, the agenda and format of our regional committees has been redesigned. The calendar and scheduling of our regional governing body meetings has been modified to better align with global governing body meetings, and we are also making efforts to improve the timeliness and readability of governing body documentation
as well as steps to enhance the transparency of the nominations and elections process. But there is, of course, more that we can and should do. Next slide, please. In 2010, the Regional Committee adopted Resolution Euro RC60R3, which requested the SCRC to initiate a cycle of comprehensive reviews of the governance of WHO Europe and to report back periodically to the Regional Committee on lessons learned. The main aim is to contribute to ensuring that Euro's governance system enhances trust, ensures transparency and accountability, and improves decision-making processes. Under the auspices of the Standing Committee subgroup on governance, chaired by the United Kingdom, and the review led by Dr. Michaela Tolt, who's with us today, this latest governance review covers the period from 2018 to 2023. It has been conducted in a spirit of participatory governance. It included 15 separate interviews with member state representatives in capitals and Geneva, as well as regular interactions with the SCRC subgroup and with the SCRC under the leadership of Dr. Marat. Thank you to everyone who has given so generously of your time over the past months and for sharing your reflections and your insights with us. We're very, very grateful. Next slide, please. In all, the report before you today covers 6 areas: the evolving climate and culture of governance innovation in Euro, the role and purpose of the SCRC with a particular focus on continuing to strengthen the SCRC and increase the visibility of its work, the nominations and elections to Executive Board and SCRC members and the processes related to same, regional mandates, including a review of how this year's process for the development of member state-led resolutions and secretariat-prepared decisions has worked in practice, procedural updates, such as to the rules of procedure of the Regional Committee for Europe and the Standing Committee, and of course the governance and operation of geographically dispersed offices, GDOs, including establishment renewal and discontinuation. We're grateful that member states have reported a significant shift in their interactions with us, that you see an increased efforts being undertaken to engage you, soliciting perspectives on technical, strategic and governance matters, and that this increased engagement has resulted in greater openness and transparency and is facilitating a more extensive dialogue between Secretariat and Member States. But as David has mentioned, we are committed to Kaizen and continuous improvement in Euro. Next slide, please. So moving forward, before you today, there is a draft decision for your consideration. Of course, decisions are a matter for Member States, but we are grateful for the proposed amendments submitted by the European Union, which support the co-creative and participatory nature of governance in Euro. Also before you today, as part of the decision, are proposed additions and amendments to the rules of procedure, including in relation to electronic credentials, which brings us into line with the practice at the global level, and also a new article in relation to the timely dispatch of documentation in all Euro languages in advance of regular sessions of the Regional Committee. It also recommends in the report that the SCRC, the next iteration of SCRC, SCRC31, takes forward the recommendations where necessary, supported by an implementation plan, which will specify follow-up of remaining recommendations. And I'm pleased to report to you all today that with the agreement of colleagues in this room, we would also continue to work with Dr. Tolt in that capacity. So Dr. Sharonov, Mr. Chair, I'd like to pass the floor back to you, please, in the interests of time. Thank you.
Thank you very much, Gabriela, for the provided report. Indeed, it's very impressive that the number of the meetings overall increased by 31%, and the special interview has been conducted, and I would like to thank Dr. Michaela Tolt for her effort of interviewing and providing the analysis. And now I would like to open the floor for any comments and remarks on the comprehensive governance review and its related draft decision. So I see Spain raised a name tag. Please, you have the floor. Over to you.
Thank you very much. Dear colleagues, I have the honor to speak on behalf of the European Union and its 27 member states. The WHO European region has traditionally led by example in many areas of governance. While we agree on the importance of alignment with the global level on governance issues, we should not shy away on being progressive and innovative when it comes to strengthening governance. While we understand that the intention of Recommendation 16 is to clarify the process for establishing GDOs, this can also be read to encourage and make it more customary to establish them. GDOs should be established in exceptional cases. It is important to continue following the principles and prerequisites outlined in the decision Euro/RC72/2 in 2012. Furthermore, in line with Resolution Euro/RC72/R8, it is important to engage governing bodies in the process. We would like to see a two-stage process, where the RC first adopts a decision to establish a GDO, and in the second phase, the offer. Thank you very much.
Thank you very much. Spain. Now I would like to give the floor to Germany, following by Monaco. So Germany, over to you.
Vielen Dank, Herr Vorsitzender. Auch hier schließt sich Deutschland natürlich vollumfänglich dem Statement von Spanien an, im Namen der Europäischen Union und ihrer Mitgliedstaaten. Ich möchte das Statement nur kurz nutzen. Wir möchten dem Regionalbüro für Europa und insbesondere dem Ständigen Ausschuss des Regionalkomitees unsere Anerkennung für die umfassende Überprüfung der Führungsstrukturen aussprechen, die darauf abzielt, das Vertrauen, die Transparenz und die Rechenschaftspflicht innerhalb der regionalen Führungsstruktur des Regionalbüros zu stärken. Der Bericht hebt einige Schlüsselelemente hervor, die aus unserer Sicht die Governance-Strukturen des Regionalbüros weiter voranbringen werden. Wir befürworten die Ergebnisse und loben den Wandel der Beziehung des Sekretariats zu den Mitgliedstaaten und in seinem Engagement auf globaler Ebene. Ein Beispiel hierfür sind die Einleitung mehrerer neuer Initiativen und Partnerschaften sowie wesentliche Verbesserungen im Management und in der Struktur der Sitzungen der Leitungsgremien. Der vorliegende Bericht verdeutlicht auch die entscheidende Bedeutung des Ständigen Ausschusses und seiner Arbeit, auch für die Stärkung der Rechenschaftspflicht. Deutschland unterstützt daher die Empfehlungen des Ständigen Ausschusses zur Steigerung seiner Effektivität. Wir glauben, dass dies letztlich nicht nur dem Gremium, sondern auch der gesamten Mitgliedschaft in der Europäischen Union, der WHO, zugutekommt. Vielen Dank.
Thank you very much, Germany. And now I'd like to give the floor to Monaco. Please, over to you.
Je vous remercie, Monsieur le Président. Comme nous l'avons dit tout à l'heure, nous souhaitons remercier Michael Attal pour les enquêtes qu'elle a faites et le rapport qu'elle a produit, et le bureau régional aussi pour cette consultation très large auprès des États membres. Nous sommes globalement d'accord avec l'ensemble des recommandations qui sont énoncées, et je souhaiterais souligner peut-être deux aspects en particulier, ce qui concerne les liens à renforcer entre le comité régional, le CPCR, mais aussi le conseil exécutif. Nous pensons qu'il est fondamental que notre région ait des voix fortes au sein du conseil exécutif et qui puisse nous représenter. Nous sommes également totalement d'accord avec les recommandations en lien avec la création, les critères de création pour les GDOs. Marc Danzon se souviendra certainement de ce qui s'est passé en Serbie à l'époque pour la création du premier GDO, où nous étions farouchement opposés à cela. Donc nous pensons, comme cela a été dit par l'Union européenne, que cela doit être quelque chose d'exceptionnel parce que ce n'est pas possible au niveau du bureau régional. Et donc nous devons avoir des critères extrêmement stricts et qui devront être aussi strictement appliqués. Enfin, nous souhaiterions avoir rapidement une petite précision concernant la recommandation 15. Est-ce que cela ne nécessiterait pas d'accroître la durée du comité régional ou de prévoir d'autres mécanismes? Mais donc nous soutenons l'ensemble des recommandations ainsi que le projet de résolution qui est présenté. Je vous remercie.
Thank you very much, Monica. Now I would like to give the floor to the Russian Federation. Over to you, please.
Уважаемый председатель, мы благодарим секретариат за подготовленный документ. Вместе с тем вынуждены с сожалением отметить, что содержащийся в проекте документа раздел, касающийся функционирования ГУО, не включает необходимых полных инструкций относительно открытия и закрытия офиса. Более того, представленный проект, описывающий обычную и экстренную процедуры закрытия ГУО, в очередной раз подтверждает то, что ранее было озвучено Российской Федерацией. Закрытие офиса в Москве не было основано на надлежащей правовой процедуре, носило произвольный, политический и бессмысленный характер. Исключительно политическая мотивация закрытия офиса была неоднократно озвучена вчера в ходе дискуссий рядом делегаций. Неготовность этих делегаций отделить политические вопросы от реальных действий на благо здоровья жителей региона вызывает сожаление. Более того, опубликованный на сайте ЕРБ-ВОС отчет о работе офиса показывает, что специалистами была проведена большая и содержательная работа на благо всего европейского региона ВОС, включая, собственно, те страны, которые выступили за его закрытие. Полагаем, что в перспективе представленный документ и содержащиеся в нем процедуры должны быть детализованы, чтобы сделать их реально отвечающими интересам общественного здоровья. Спасибо.
Thank you very much, Russian Federation. Are there any other member states who would like to take the floor? I don't see any nameplates raised. So then we now will provide, I'm asking our international partners to raise their nameplates if they wish to speak. I don't see any nameplates raised. Then I would like to ask, so actually the Secretary has received one request from a non-state actor, but it was already announced by the European Nursing Student Association. And by this, I would like to give the floor to Ms. Jacob to provide any responses. Please.
Thank you very much, Mr. Chair, and thank you to Spain on behalf of the EU, to Germany, to Monaco, and to Russian Federation for the interventions, which are very helpful in guiding us as we continue our work in relation to governance in Euro. Specifically, with regard to the question from Monaco regarding recommendation 15, if I can direct you to paragraph 64 of the report in relation to continuing calls for transparency in regional election processes and greater scrutiny of regional candidates through a public hearing of candidates in order to ensure appointment of the person best fitted for the role. So the recommendation made, recommendation 15, is in the context of that feedback from the process. Thank you very much. With regard to the comments from the European Union in relation to GDOs and also from Monaco in relation to GDOs, we are very happy to continue to work with colleagues in SCIC 31 to continue the work regarding SOPs, standard operating procedures, for the establishment, renewal and discontinuation of geographically dispersed offices in line with the principles of the strategy and also the criteria set out in the strategy, which have been further elaborated in the review that has been undertaken on this occasion. This is a topic that has a long history in Euro, and we are very happy to continue to work on this further so that there's a comfort for all colleagues in regard to those standard operating procedures. So thank you very much for that. Specifically in relation to the Russian Federation's comment regarding the report on the work of the Moscow office in relation to non-communicable diseases. This was a 9-year report which was prepared by the technical colleagues and was published as a background document to this committee, so it is available through the website. But I'm happy to provide further information on that to colleagues. I think I'll stop there, Mr. Chair, but if there's anything I haven't answered fully, happy to do so. Thank you.
Thank you very much, Ms. Gabriel. And now we have to move to the adoption of this section of the item. So, as for the adoption of that section of the item, we also should go by the consensus, but if more time needed for the clarifications, we can also suspend the decision by this section of the item. So, is there any concerns, or shall we adopt the proposed draft by consensus? So for the clarification, the draft decision contained in the document EUR/RC73/conf./10 revision 1. So on governance of the WHO Office for Europe. So is the committee willing to adopt the proposed draft decision by consensus? So I see no objection, and therefore the decision is adopted. Thank you. So with this, I thank all the delegates for their working together to achieve a consensus. And I would like to now invite all of us, all the delegations, to have a lunch. So please return back by 2:30 p.m. Astana time, and please enjoy your lunch. Thank you very much.